Do you feel like your stomach is a balloon about to pop after eating? Are you constantly battling gas, bloating, and unpredictable bowel habits? You're not alone. Many people experience these frustrating digestive issues along with strange symptoms like dizziness, insomnia, and skin problems. Despite numerous doctor visits and medications, relief seems out of reach. What if there's a hidden reason for why you feel uncomfortable? Many people suffering from these symptoms have an underlying issue, SIBO, or small intestinal bacterial overgrowth, or Candida overgrowth. Today, we will explore the differences between these conditions and uncover natural healing protocols that can help you reclaim your health. If you find this information helpful, please hit the like button and share this video with others who might benefit. Don't forget to subscribe to our channel for more health tips and insights. Friends, you might ask, Doctor, what is the root cause of SIBO? As always, we'll discuss the root causes. The primary causes are: first, a diet high in carbs and sugars, including excessive consumption of bread, pastries, sweets, pasta, and even healthy carbs like potatoes, brown rice, or quinoa. This leads to bacterial or parasitic overgrowth in the small intestine. Second, if you had a stomach infection and took a strong antibiotic cocktail, these antibiotics kill both good and bad bacteria, but bad bacteria are usually resistant. This imbalance causes SIBO. Many people who took antibiotics for a stomach infection later developed symptoms like anxiety, panic, gas, constipation, and abdominal cramps. Have you experienced any of these symptoms? Share your story in the comments below and let us know how you are managing your health. Your experiences can help others. Third, if you use acid-suppressing drugs like Nexium, Zantac, or omeprazole for a long time, it can lead to SIBO. These drugs reduce stomach acid, which is essential for sterilizing the digestive tract, especially when eating out or consuming processed foods. Fourth, any type of surgery, whether appendectomy, C-section, or any digestive system surgery, can disrupt the balance of good and bad bacteria, leading to SIBO. Overuse of anti-inflammatory drugs like ibuprofen or paracetamol also contributes to this condition. Now that we know the root causes, let's distinguish between bacterial and parasitic overgrowth. Typically, severe digestive symptoms indicate bacterial overgrowth, including severe gas, bloating, constipation, diarrhea, bad breath, and smelly gas or stools. Parasitic overgrowth often causes fungal infections in other body parts, like white patches on the tongue, fungal infections in nails, or recurrent vaginal or urinary infections. People with bacterial overgrowth usually don't have these external fungal infections seen in Candida. If you haven't already, make sure to subscribe to our channel for more videos like this. We're here to help you with your health journey, one step at a time. Another difference is the severity of leaky gut symptoms. Both bacterial and parasitic overgrowth can cause leaky gut, where toxins leak into the bloodstream, triggering an immune response. However, Candida overgrowth causes more severe and early leaky gut symptoms compared to bacterial overgrowth. Candida fungi, like those found on old bread, create tiny holes in the gut, leading to quicker and more severe leaky gut symptoms. Parasites produce a substance called acetaldehyde, similar to alcohol, affecting the nervous system and brain like alcohol, causing dizziness, fatigue, and mental fog. These symptoms are more severe with Candida than with bacterial overgrowth. Another difference is histamine intolerance. Harmful bacteria release a lot of histamine, causing allergy-like symptoms such as sneezing, itchy eyes, and a runny nose, along with rapid heart rate and high blood pressure. If you have unexplained heart rate issues and high blood pressure, it could be histamine intolerance from bacterial overgrowth. Bacterial overgrowth produces smelly gases like hydrogen, methane, and sulfur, causing bad breath and smelly gas, unlike parasitic overgrowth. Now, let's talk about lab tests to distinguish between bacterial and parasitic overgrowth. First is the stool analysis, which can detect Candida, E. coli, and other harmful bacteria. Second is the lactulose breath test, which measures hydrogen, methane, and sulfur gases produced by harmful bacteria after consuming a sugary solution. If you have bacterial overgrowth, these gases will be detected in the breath test. If you have fungal overgrowth, the test will be negative. Third, A white blood cell count test can indicate bacterial overgrowth if the count is over 12,000, or fungal overgrowth if it's below 4,000. Fourth, antibody tests for fungi and Candida can show high levels in people with fungal overgrowth.
Now, let's discuss the natural healing protocol for bacterial or fungal overgrowth. There are 5 or 6 steps with slight but crucial differences. First, avoid all foods that cause allergies or irritate the colon for about 2 months. This includes all dairy products, gluten, refined sugars, corn, soy, and hydrogenated fats. People with Candida should also limit healthy carbs like brown rice, quinoa, and sweet potatoes to less than a quarter cup per meal. Second, kill harmful bacteria and Candida with natural antibiotics and supplements. For Candida, caprylic acid, found in organic coconut oil, is effective. Take a tablespoon of organic coconut oil on an empty stomach, or a caprylic acid supplement for a month. For bacterial overgrowth, use oil of oregano or berberine supplements to kill harmful bacteria. Third, enhance digestion with digestive enzyme supplements for 3 to 4 weeks to prevent undigested food from feeding harmful bacteria or fungi. Fourth, strengthen the gut lining with collagen supplements or bone broth rich in collagen, amino acids, and proteins. Omega-3, magnesium, and zinc supplements are also essential for healing the gut lining. Fifth, take beneficial bacteria, probiotics, with caution. For those with parasitic overgrowth, probiotics can be taken from day 1. For bacterial overgrowth, avoid probiotics for at least 4 weeks to prevent worsening symptoms. In the 5th week, introduce soil-based probiotics like soil-based spore probiotics, which are coated to survive stomach acids and reach the colon. Ensure the probiotic supplement contains the safe bacteria strains Bacillus coagulans, Bacillus subtilis, Bacillus clausii, and Saccharomyces boulardii. Be cautious of cheap commercial probiotics that may contain harmful bacteria. Lastly, reduce stress and ensure adequate sleep to support the immune system and prevent SIBO.
Friends, we've reached the end of this episode. We've discussed in detail the differences between bacterial and parasitic SIBO, the appropriate tests, and the differences in treatment. If you liked this episode, please give it a thumbs up and share it with your friends and loved ones. If you have any questions or comments, leave them below. I read all your comments and appreciate your kind words. Also, don't forget to subscribe to our channel for more informative videos on health and wellness. Your support helps us create more content to help you live a healthier life. See you in the next health episode. Goodbye.